Hi. Next February, I'm running the Compassionate Mind Training course again, CMT. And so I thought I'd just give you a bit of a sense of the CMT session by session outline. First of all, CFT, Compassion Focused Therapy. If you're interested in some of the deeper look at compassion focused therapy, do go to this book, Compassion Focused Therapy, Clinical Practice and Applications by Paul Gilbert and Gregoris Simosh. This is a wonderful compendium of all things CFT as well as special applications. But as you'll see there, CFT is an approach to psychotherapy. It's really rooted in evolutionary psychology, attachment theory, psychological science, and an understanding of motivational systems, as well as the wisdom and spiritual traditions. And it was originally developed for those suffering from self-criticism and shame. This ubiquitous transdiagnostic phenomenon, this idea of self-criticism and shame. And there's really a growing evidence base now. Depression and anxiety and stress, eating disorders, post-traumatic stress disorder, and complex PTSD, and several other areas. And as a psychotherapy, of course, CFT has a focus on a therapeutic relationship, doing an assessment and coming up with a case formulation, goal setting and treatment planning, and so on. CFT incorporates compassionate mind training. So in some ways, CMT is the psychoeducational and the skills-based aspects of CFT. Paul Gilbert and Chris Irons first talked about CMT back in 2005. But if you're interested in learning more here, then Chris Irons and Elaine Beaumont wrote the Compassionate Mind Workbook, a step-by-step guide to compassion-focused therapy in 2017. And that's a very practical workbook that you can kind of work through to understand CMT and to apply that to yourself. In CMT, we're really covering definitions of compassion across the three flows, including too the common fears, blocks, and resistances to compassion. We're also talking about the evolved nature of the mind and the body, that we have these tricky brains that get caught up in old brain, new brain, loops of the mind, and that the nature of our suffering is really not our fault. CMT also incorporates attention training, mindfulness, body-based practices, imagery-based practices, acting exercises, chair work, and embodiment. And ultimately, it's all about the cultivation of the compassionate self, with wisdom, strength and courage, and a caring commitment, used to manage life difficulties, and not least, of course, our own self-criticism. Oh, and I always like to mention my book. This is a kind of a self-help option or a therapy companion option. The Gifts of Compassion. Basically, this is really just a very engaging, plain language way to get into the psychoeducation and skills of compassionate mind training and compassion-focused therapy. There's the book, and there's a personal practice workbook that goes with it. But CMT. So this is an 8-week group-based course, actually really designed for the general community, although it's starting to be used for people who might be experiencing certain types of psychological distress. It was developed by Chris Irons, but also Charlie Heriot-Maitland. And actually, they published this paper in 2020, which outlined a randomized controlled trial of compassionate mind training. And across the 8 weeks, we go through a whole range of topics. Week 1, we all have tricky brains. Week 2, we talk about our 3 emotion systems. Week 3, we start to develop a compassionate part of you. Week 4, we start being that compassionate part, being our compassionate selves. But to start with, compassion flowing outwards. Week 5, we look at compassion flowing inwards, receiving compassion. Week 6, it gets on to self-compassion, turning up for yourself. Week 7, we start to direct the compassionate self or the compassionate mind towards our own self-criticism or our critical self. And then week 8, we start directing our compassionate mind towards other, sometimes difficult, emotional parts of us. In week 1, we all have tricky brains. It's an exploration of the evolutionary-based CFT definition of what compassion is, the reality checks of how and why we suffer, and an introduction to the concept of the tricky brain and loops that we get caught up in our own minds. Week 2, our 3 emotion systems. So this is an exploration of the 3 systems model of emotion. And you might have come across this before if you've watched other videos on my channel. Threat, drive, and soothing systems. And along with these ideas about how to balance the systems in a way that might lead to less distress and more well-being in life. Week 3, developing the compassionate part of you. So here we explore the concept of self as made up of multiple parts rather than unitary or one part. And compassion is just one of those parts, a kind of self-identity. So we begin with some practices that will involve ways to develop the compassionate part, or what we go on to call the compassionate self. In week 4, being your compassionate self, but compassion flowing out, this is really an introduction to the concept of compassion as flow. It flows in 3 directions: towards others, from others, and to ourselves. And so in this week 4, we'll focus on directing the compassionate self towards others. We'll also have a bit of a chat about what can make compassion to others difficult. We call this the fears, blocks, and resistances to compassion, in this case, for others. We all have them. We all have these fears, blocks, and resistances. And often an important part of CMT is to try to see if we can work our way through those various blocks. Week 5, compassion flowing in. This is an interesting one. This is about discussing the importance of being open to receiving care and compassion from others. Not one that people always think of when they think of compassion. But we'll also talk about what can get in the way of this too, the fears, blocks, and resistances to receiving compassion from others. Week 6, and we get to self-compassion, turning up for yourself. In this session, we're absolutely focusing in on self-compassion now, including various practices that we can use to cultivate self-compassion, but also an exploration of what might block this too, the fears, blocks, and resistances to self-compassion. In week 7, we start to direct the compassionate mind towards working with certain difficult parts, in this case, working with the critical self or the self-critic. So we'll explore self-criticism, its functions, and how to direct compassion to it, and maybe the reasons for why it operates as it does. We'll also explore how the compassionate mind can be used to approach an upcoming difficulty, looking ahead and being able to prepare for a difficulty that we might face, but with compassion. And finally, in week 8, we start directing our compassionate mind to some other difficult emotional parts. We'll go on to explore a little bit different emotional reactions to a particular difficulty. We'll think about this in terms of multiple selves, especially angry self, anxious self, and sad self. And also how compassion can help support this process. And then finally, in the course, we'll explore different ways to continue on the practice to extend compassion to ourselves, but also to others, or receiving compassion from others, and how to keep taking a compassionate approach into the future. Compassionate mind training and compassion-focused therapy really take an evolutionary-based approach to compassion and self-compassion, but also to working with life's difficulties. So too in CMT, we take an evolutionary approach across the 8 sessions, where gradually over time, we develop a real sense of our compassionate selves. So, I hope that gives you a little bit of a sense of the CMT course. If you'd like more information, or if you'd like to book in for my next course starting in February, then please email us at cmt@psychologyconsultants.com.au. Thanks so much for watching.